Good morning, everybody. Now, just I am going to do some activities about Unit 2. The name of the topic is Health and Hygiene. Now, here, getting started, look at the picture and discuss what health means. Now, here, health means relaxation, happiness, and athlete, fit, sport, training, mind, diet, no, and dieting, maintenance, mental, hygiene, care, nutrition, science, lifestyle, now, spirit, willingness, wellness. No, all these are the words which are related with health. And we are going to discuss in this unit about health and hygiene. Now, this is the picture. Here, our reporter is taking interview from a doctor, from a manager, and you can read here. Before you read the interview, answer these questions. Have you heard about telehealth services? Can we get a doctor's advice without visiting him or her? And the acceleration behind the telehealth services. In this interview, Chun-Kai Chang, the business development manager of Telehealth at Advantech, talks to News Medical about the acceleration behind telehealth services. Now, reporter asks question first of all. To begin, can you give us a brief introduction into telehealth and what it involves? Now, after that, Chung-Kai Chang says telehealth is a method of providing medical care remotely, usually through video chat. Telehealth makes it possible to connect patients and clinicians from any location. It provides access to a wide range of care, including primary care, consultations, psychotherapy, physical therapy, and even emergency services. It allows primary care clinician and a specialist to further their reach for treating patient whether there is an internet connection. After that, the benefits of telehealth for healthcare providers and patients is that these services can be faster, safer, more effective, and less expensive in the long run, especially during a time like the COVID-19 pandemic, where telehealth has allowed access to medical care without going to hospitals to protect patients and hospital staff from being exposed to the infection. Now, after that, reporter again asks the question, what are some of the main drivers behind the acceleration and momentum of telehealth services? Now here, momentum, now driver means part in a mechanism that receives power directly or transmits motion to other parts. यो जुन के हो त एउटा यस्तो उपकरण जो अरू शक्ति आफूमा लिएर अनि त्यो अरूलाई सञ्चालन गर्दछ, that is called with driver. Now, what are some of the main drivers behind the acceleration and momentum of telehealth services? And momentum means no the quantity of motion of a moving body. No acceleration प्रवेग and motion चाहिँ यस्तो मुभिङ बडीमा जुन मोसन हुन्छ त्यसको क्वान्टिटीलाई मोमेन्टम भनिन्छ. Chang, there are two major drivers for this fast growing market. The first and most recent driver for telehealth has been the global COVID-19 pandemic. A strong social distancing and minimal physical contact precautions have pushed the shift to telehealth and remote consultations as it aids in infection protection. Now, these precautions are and increased hospital bed shortage have forced medical facilities to incorporate more telehealth technologies to keep up with demand and maintain care continuity for patients at home. No, incorporate means no to take, no assimilate, absorb. Now, after that, the second driver is the shortage of medical professionals when demand is increasing every year due to an aging population and more patients with chronic and non-communicable diseases. For example, living in rural areas, their medical demands are underserved due to sufficient resources and long distances to drive into cities for care. No, underserved means here no inadequate, पर्याप्त न होनु, सेवा पर्याप्त न होनु. Now, telehealth is one of the promising ways to tackle the challenges of doctor shortage and expand specialties and doctors' reach to patients. Now, reporter again asks the question in terms of this acceleration and momentum of telehealth services, we are currently seeing what are some items we can expect to see in the future. Now, the response of the above question, Chang replies, telehealth will not replace face-to-face care service, but we will incorporate it into telehealth care facilities, infrastructure. Patients will be selecting providers based on their accessibility to telehealth service with more access to doctors, increasing patients using preventative care services and follow-up care due to convenience or subida will start to emerge. These can lead to fewer readmissions and patient complications. We will also see more use for early screening of patient triage in the field before they arrive at hospital. Now, triage means here process of sorting patient, that we call that triage. Now, after that, reporter asks again another question, when it comes to remote patients monitoring for clinician, what impact does telehealth have on this? Chang replies, remote patient monitoring could be one of the applications of telehealth. Remote patient monitoring usually involves continuously collecting patients' health data through wearable devices such as vital signs and blood sugar. The patient's data is then transmitted in real time, monitored, and reviewed by medical providers. In this way, medical providers could acquire a whole picture of a patient's health condition and give a more precise diagnosis. Then reporter put another question, how does telehealth shape the way clinicians work with each other? Now Chang replies, clinician to clinician telehealth services have enabled medical professionals to collaborate virtually with a specialist in other locations to deliver treatment and care to patients jointly. This service can range from remote surgical, surgical mentoring to Tele-ICU, intensive care unit, and Tele-ER like a stroke, in which on-site staff work together with a remote physical or a specialist physician or a specialist team to access patient's condition. Telehealth solutions relieve the pressure of staffing gaps seen in critical departments such as an emergency room and ICU. Reporter, what would you say are some of the biggest challenges clinicians currently face with telehealth? Chang. Many hospitals are still facing the lack of infrastructure to implement telehealth successfully. Insufficient hardware and the right technology for each specialty. Some hospitals struggle with reliable networking infrastructure like broadband, 4G, or Wi Fi. This could limit the connectivity within facilities and provide remote care to rural areas or mobile clinics. Having the right technology and tools and place will be crucial to successful telehealth programs. Even though this new technology is quickly being integrated, there is a learning curve to using telehealth versus traditional healthcare operations. Similarly, users face obstacles such as learning to use different tools, online scheduling for virtual visits, triage procedures, and billing policies. To overcome these challenges, telehealth should be encouraged as a regular service and included in health insurance. There would be more motives for healthcare providers to invest in infrastructure and information system integration and deploy telehealth technology. Okay, thank you for today.